Okay, so let's move on. Ready? Okay, so before we start, let me share with you some empowerment strategies. I know some of you have the energy dwindling already. It's waning off. So the key, when you're in front of the computer for 5 hours and you're taking the NCLEX, take note. You have to know how to empower yourself. Okay? So if we talk about empowering ourselves, the first strategy is self-awareness. When you are taking your test, you have to be aware. Listen to your body. Listen to your mind. When your mind is already wandering, time to take a break. But remember, on the NCLEX, the clock will not stop even if you take a break. So if you take a break, okay, make sure that you do your thing properly. My suggestion, bring with you a small amount of psychotic and mineral water, place it in the locker, have a chocolate. When you take a break, eat your chocolate, then drink your psychotic supplement. It would help you out. Remember, it will sustain you, okay? So, self-awareness means listening to ourselves, being aware of ourselves. So it talks about the power of self-awareness. Well, not this type of power. This is this is not the type of power that I would like you to be. Okay, so the power of self-awareness begins with looking at ourselves and uncovering our complexities. Remember these times of pandemic? Wala kang kakampi, you don't have anybody or anyone with you but yourself. So you have to be gentle with yourself. You have to be more forgiving with yourself. Therefore, we can increase or decrease our risk of dying due to stress by simply changing our beliefs or what we think about stress. Okay. This is what I'd like to highlight. View NCLEX as a challenge and never a threat. Why? Let me integrate the findings of some researchers. They found out that those who think of things as challenges are able to live longer lives than those who tend to view things as threat. Because what they say is that the mind could have defense mechanisms to overcome challenges, but it would be very, very difficult for the mind, okay? Very, very difficult for the mind, okay, to overcome threats, especially when your energy is waning off. So therefore, having the right mindset that the NCLEX is just a challenge, it's just one of those hurdles that you need to grapple with, would help you out eventually. Okay? So always remember, the NCLEX is just a challenge. So self-talk to your body. Tell your body, my body is enabling me to face these challenges. Okay? And the first concept for session 3 is the drug Adalimumab or Humira. Okay, so first, let's talk about the classification of Adalimumab. Okay, so Adalimumab is actually an anti-TNF medication. Okay, first, you have to understand what's TNF. That's tumor necrosis factor. Tumor necrosis factor induces inflammation. Okay, now your Adalimumab is anti-TNF. Therefore, the main action of Adalimumab is it decreases inflammation. Okay. That's why you see patients receiving these medications when they have systemic inflammatory conditions. Okay? Okay. So, what are the common side effects of Adalimumab? You have pain and pruritus at the injection site. Okay? It could also progress to back pain. And then there's going to be mild rash and nausea and vomiting. Okay. Now, is there anything that you need to tell your patient to do before beginning their treatment with Adalimumab? First, they have to be screened for tuberculosis. And to do that, they have to undergo X-ray. Okay? Why? Because if they're positive for tuberculosis, the administration of Adalimumab may potentially worsen their condition. Okay? Some of the medications that could be used as alternative for Adalimumab would be your Infliximab. But what I want you to remember would be your Adalimumab. Okay? Okay. The concept. Adalimumab or Humira blocks inflammatory effects of tumor necrosis. Therefore, If you are asked a question, which of the following nursing diagnosis is the highest priority for a client taking adalimumab? Impaired skin integrity, altered tissue perfusion, risk for infection, risk for injury. Well, since it has the potential to suppress the inflammatory process, then it has a potential to cause infection. Okay? So a patient who's taking adalimumab is at risk for infection. Don't forget. Okay? Next, which of the following conditions can be treated with adalimumab? Okay? Inflammatory conditions like ulcerative colitis, yes. Crohn's disease, yes. Rheumatoid arthritis, yes. Ankylosing spondylitis, yes. Psoriatic arthritis, yes. Okay, now take note, class. Here, you have all the ITs. Remember, we said that adalimumab would actually decrease inflammation. So any inflammatory condition could be treated with the drug, especially if it's severe. Okay? Okay. So that's what I want you to remember about adalimumab. Next. Wow. Something I'm sure you may not be so familiar with, but I know you will be surprised to know that this is something that you already know, but you just don't know that this is what it's called. Okay? In other words, this is gonna be your aha moment. Okay? When you say aha moment, you say in Tagalog, ayun pala yun. Okay. What is Lynch syndrome? Okay. Let's laymanize Lynch syndrome. It's actually your colon cancer. Oh, okay. So if you would meet this term on the test, Lynch syndrome, it's plain and simple. Think about colorectal cancer. So that's what NCLEX is all about. Sometimes they use terms like Wilson's disease to tell you this is going to be liver failure. Alport syndrome, that's glomerulonephritis. See? You try to attach these things, new things, with all things that you already know, and you try to bridge and differentiate the two, and that's it. You're going to get through NCLEX with flying colors, I tell you. Okay? So, what's Lynch syndrome? The old name is HNPCC, hereditary non-polyposis colorectal cancer. It also causes breast and prostate cancer. So when you say Lynch syndrome, it's a combination of colorectal cancer with breast and prostate cancer. Okay? Okay, now, I'd like to highlight two things. First, if you have a question that's asking you who would have the highest risk, and the next question would be one that would ask you who would be at high risk. Okay? So these two are different. First one, who will be at highest risk? The second one, who will be at high risk? Okay? There's only one factor that puts you at highest risk for Lynch syndrome. And it's here. The term hereditary. So familial predisposition. If you ask, who is most at risk for Lynch syndrome? Somebody who have it in the family. All the other risk factors like diet, alcoholism, smoking, this will just put the patient at high risk, but not at highest risk. Clear? So if the question is talking about which will put you at highest risk, look for the hereditary factor. Okay? Go. Here's a sample question. What if you have this type of question in front of your computer about Lynch syndrome? It's the first thing that you've actually met the term. So you can just imagine what reaction you will have. Okay, you'll have your eyeballs rolling upwards. Okay, so which of the following statements about colorectal cancer is true? Let's begin. Vitamin D may be an important cofactor in immune protection against colon cancer risk, and that's a big check. Body mass index of more than 30 has been consistently associated with increased incidence and mortality. Yes, because that's indicative of obesity. BMI of more than 30 or more. That categorically defines obesity. So it's a check. The dominant risk factor for colorectal cancer is increasing age. Yes, it's a dominant risk factor, but the factor that will put you most at risk would be heredity. Okay? Duration of survival with colorectal cancer has greatest association with cancer stage and diagnosis. Yes. Men, take note, have higher risk than women. Yes. The incidence of colorectal last decade is decreasing. Yes, because of early testing. So it's decreasing, it's not increasing. And Black African Americans has greatest colorectal cancer incidence and mortality, yes, because of their high-fat diet. Okay? Okay. Now, this is also something I'd like to highlight when we're talking of colon cancer. You have to know how to differentiate non-modifiable from modifiable risk factors. When you say non-modifiable, we can't do anything about it. Example, advancing age. Those are age 50 onwards, most at risk to cancer. So is there a way that you prevent cancer from developing in your body? Yes, commit suicide before turning 50. Of course, I'm not espousing that, just a joke, okay? Some people would say, commit suicide, you kill yourself so you don't get cancer, okay? Personal and family history of polyps or cancer, and inflammatory bowel condition. So history of ulcerative colitis or Crohn's disease will make you at risk, and that's non-modifiable, as well as inherited syndromes. So if one family member had polyps or cancer and ulcerative colitis, you better have yourself monitored because these risk factors are non-modifiable. Okay, let's move on. What about the modifiable risk factors to colon cancer? You have obesity. Okay, this is what we note when we look at ourselves in front of the mirror. Obesity, sedentary lifestyle. You're always seated, always reading, you're not moving. Diet high in red meat and processed meats. Okay, those of you who have the ladies have a lot of boyfriends, okay? That's just a joke. Diet high in red meat and processed meats. Okay, smoking, alcohol drinking. Now, this is one thing I'd like to highlight. It's not even alcoholism. It's alcohol drinking. If you are drinking more than 2 drinks per day for men and more than 1 drink per day for women, you are at increased risk, okay, for colon cancer. And the definition of 1 drink should not be more than 1 glass, okay? So for men, okay, not more than 2 drinks per day. For women, not more than 1 drink per day. So if you are drinking alcohol, even if you're not an alcoholic, you are at risk to colon cancer. Okay? So let's move on to our next NCLEX quick fix concept. And this is going to be standard precautions. Okay, now, some items on standard precautions would definitely deal with true or false statements. You know, there's one good thing that you have to think of when you're faced with multiple choice with multiple response or SATA questions. Huwag niyong isipin that it's difficult. Think about it as true or false that are just combined together. So all you have to do is to ask yourself, is this true, is this false? So SATA is just combination, multiple choice that deals with a true or false statement. That's how you deal with it. If you want to deal with it the easy way, okay? So let's move on and let's talk about standard precautions. Okay. So what are the conditions requiring standard precautions? I compiled everything that I'd like to highlight here. So even if we're gonna have like our next quick fix session on October 3, this one could still be true, okay? This one could still be true because, you know, I compiled this already. It's all for you guys. Okay, I hope it serves the purpose. So for patients with hepatitis A, B, C, D, and G, all types of hepatitis, okay, patient is placed under standard precautions, which simply means we don't need to have them in a private room, okay? We just have to observe standard precautions. So wear latex gloves when handling feces, urine, saliva, and blood. Now, this is a special precaution, special important consideration when we're talking of handling the bedpan of the patient, okay? So you have to wear gloves. If soiling is expected, you also need to wear your gown, okay? Next, Giardia lamblia, which is a form of acute gastroenteritis. It's called traveler's diarrhea. Use contact precautions for diapered and incontinent patients, but for adult patients, standard precautions. Once again, contact precautions for diapered and incontinent patients, but for adult patients, standard precautions, okay? Lyme disease caused by Borrelia burgdorferi. Take note that there's no person-to-person transmission, so just standard precautions. Remember this class, plague, bubonic plague, okay? The bubonic form is the most common characterized by painful swollen lymph nodes. So if they don't say plague, they just describe syndromic presentation of data. They just describe that a patient has painful swollen lymph nodes. Think about bubonic plague and think about standard precautions, okay? So avoid contact with infected body fluids and tissues of the patient. Then Roseola infantum, there's no specific treatment. Acetaminophen or ibuprofen is given to control the fever and implement standard precautions. Don't forget. And of course, West Nile virus, no vaccine, no specific treatment, just implement standard precautions. So if you have a SATA question that deals with this, which of the following conditions should be placed under standard precautions? You would say hepatitis A, yes. Giardia lambda, yes. Lyme disease, yes. Plague, yes. Measles, no. Definitely that's airborne. TB, no. Definitely that's airborne. Roseola infantum, yes. West Nile virus, yes. So remember this class, okay? So remember this test-taking key. Anticipate concepts but never expect canned answers. Ano yung canned answers? Sometimes, when we see a concept, because we got influenced by some of our friends who told us, you study this, you study that, this is my answer, this is my answer, don't do that. Because if you have a predetermined set of answers when you sit down for the NCLEX, that's going to be a little dangerous for you. Okay, because you are no longer analyzing questions, you are no longer reflecting on the concepts you've learned. What you're doing now is to just give canned answers. And will that help? Nuh-uh. Okay, so I would not recommend that you be influenced by friends who have taken the test on what answer should you give. It's just all right to be familiar with concepts, but not their answers. Okay? So here's an example. Where there's a will, there's a, here's an example of a canned answer. Where there's a will, there's a, they would usually say, where there's a will, there's a way. That's one thing you already know. But look at this. What about if this is of course just a pun or a joke, just to break the monotony, okay? What about if I say, where there's a will, there's a relative who will be the beneficiary in the will, right? So that's what I'm trying to tell you guys. Anticipate, but do not memorize canned answers, okay? So just to thread through our next topic, it's going to be on self-determination. And when we speak of self-determination, we'll be talking about advanced directive. So an advanced directive guides life-sustaining medical care and end-of-life decisions. You have to consult the advanced directive of the patient so that you won't be committing any crime. Because if you did something that the patient does not want to be done on him or her, then you have committed a crime because you never consulted an advanced directive. So there are two types. You have the living will, which would actually list life-sustaining decisions, things that you want to be done on you. And the durable power of attorney for healthcare, which names a health proxy. It will identify somebody who will make the decision on your behalf when you no longer can make the decision because you're bedridden, you're in comatose condition, or you're so severely ill. Okay? So that's the difference. Okay, subjects covered by an advanced directive can include the treatment that you would consider having, what types of treatment you would never wish to have, your end-of-life care, as well as if you are willing to donate organs, okay? Now, when do you actually check your advanced directive? So, re-examine your advanced directive every few years if there are changes, okay? And take note, whenever any of the 5 Ds occur, like every decade of your life, you can actually review your advanced directive every 10 years. When a relative dies, okay, or when a loved one dies, review your advanced directive. Or when you are engaged in a divorce proceedings, review your advanced directive. When you're diagnosed with an illness or a serious heart condition, and when you note, when you have an experience that is significant enough to tell you that your health is declining or your health is deteriorating, then there's a need for you to check on your advanced directives. Okay, remember this. The nurse cannot serve as a witness to the advanced directive of a client directly under her care. That's going to be conflict of interest. Okay? Okay, so here's a test taking key. Stick to what the latest evidence suggests. So if you are reading old literatures, like for example, the priority for flu vaccination before 2012 is different, okay? It's usually the home residents or the elderly in home care residents. After 2012, they've changed it to the pregnant women, who should be the priority. That's according to the protocol by the World Health Organization. So stick to what the latest evidence suggests, okay? Now, if you talk about evidence-based answers, don't just base your answers from what you read on social media or from the internet. Like this, look at this. Vegan mom claims she can boost her immune system to beat coronavirus by drinking sperm smoothies. See? Is that evidence-based? Okay. There's a blogger who claims drinking a smoothie with a shot of her boyfriend's sperm is helping her to beat coronavirus. Okay? Okay. So, he drinks her boyfriend's sperm every day, either directly or as part of a smoothie. Can just imagine this. Okay? And she said it's because it's full of vitamins, and just because of this, she haven't got a cold or a flu since drinking it in 2017. My God. This is the issue now with the internet. The issue now is between experience and expertise. So make sure that when you're reading articles related to health conditions, when you're preparing for the NCLEX, you read from experts, okay? Because they have whatever they place on the internet as a product of research and validation processes. But on the other hand, who can argue with somebody who's talking based on experience? But again, experience is not true for all. It's very specific to the person who experienced it. So your experience might be different from the experience of another person. So when you are preparing for the NCLEX, make sure that you're reading from the experts, validated information, okay? Well, you can just read these types of articles just for fun, okay? But look, Tracy freezes the sperm in an ice tray to use for another day, okay? But there's a doctor in the same article who says, there are hundreds of myths out there about how to protect yourself against COVID. Most of them are exactly that, myths. The idea of drinking semen doesn't have the slightest nugget of science behind it, and it is frankly extremely worrying. And then one student of mine actually asked me a question, okay? Can this lead to pregnancy? So if you drink sperm, will it lead to pregnancy? And then I answered back, what type of pregnancy? Ectopic pregnancy of the larynx? Okay. Definitely, the esophagus is not connected to the uterus, so it's not going to lead to pregnancy, right? Okay, so this is our next topic. We're going to talk about the danger signs of pregnancy. Now, there's one issue that nurses have a lot of difficulty deciphering if it's correct or not, and it's on the issue of bleeding during pregnancy. Okay, now there's such a thing as implantation bleeding, and it's expected within the first several weeks after implantation. Therefore, it's not true that all forms of bleeding during pregnancy is a danger sign, okay? Not all forms of bleeding during pregnancy is a danger sign, okay? So we have to be clear on that. So what are the danger signs? You have this in your PDF file, absence of fetal movement, or when there is abdominal pain. So remember to check on fetal movement every hour, and there has to be at least 1 to 2 fetal movements. Persistent vomiting beyond the first trimester, okay? This is actually a condition known as hyperemesis gravidarum, which could actually lead to fluid and electrolyte imbalance, okay? Pelvic pressure, low backache, and leaking of fluid from the vagina. So any vaginal leak, okay, which could be from premature rupture of membranes, must be evaluated by the healthcare. And of course, excessive weight gain, more than 2 pounds per week, beginning on the second trimester. This could be indicative of gestational hypertensive disease. And swelling of the fingers or spotting, which simply means there's excessive weight gain. Now remember, so if a pregnant woman tells you that the wedding ring, she has difficulty wearing the wedding ring, then assess the patient for preeclampsia or gestational hypertensive disorder. But, okay, if the patient is not pregnant, but the patient has difficulty wearing the wedding ring, well, you better ask her if she is indeed the wife. If the wedding ring doesn't fit, it could mean she's the mistress. Okay? Okay. No, just kidding aside. Okay. So let's talk about bleeding in pregnancy as a danger sign. Not all bleeding or spotting during pregnancy is serious. Vaginal bleeding during pregnancy needs to be reported to the healthcare provider, and spotting refers to a few drops of light blood flow, while bleeding involves a heavier flow. So most of the time, treatment for spotting or bleeding is plain and simple bed rest. Okay. So what are the different characteristics of bleedings that you have to be familiar with? Spotting in early pregnancy, this could actually mean there's ectopic pregnancy infection, or this could be this could happen after sex, or there's potential miscarriage. Light bleeding in the first 4 weeks, that's implantation bleeding, it's expected. Bright red or dark brown discharge in the first trimester with grape-like cyst, that's molar pregnancy or H-mole. Okay, now usually the manifestations of H-mole and that of preeclampsia are almost the same. The only difference is that the manifestations of molar pregnancy occurs in the first trimester, whereas the manifestations of preeclampsia usually occurs beyond the 5th month of pregnancy or during the 2nd trimester. Okay, when there's heavy bleeding before 37th week of pregnancy, then you have preterm labor. Okay. During the first trimester of pregnancy, okay, abortion and ectopic pregnancy could be the common causes of bleeding. In the 2nd trimester, it could be associated with H-mole, pregnancy-induced hypertension, and incompetent cervix. And then the 3rd trimester, you have placenta previa and abruptio placenta. Now, what is one thing that I'd like to highlight, okay? The causes of bleeding in the 3rd trimester, placenta previa and abruptio placenta. Okay, now take note, if a patient, for example, here's a scenario, had a car accident and all of a sudden had abdominal pain that is coupled with bleeding, what do you suspect the patient to be suffering from? Abruptio placenta. Is that a danger sign? It is. And so therefore, you have to keep the patient on bed rest and expect that the patient will have to undergo your ultrasound. Okay? So it's very important to monitor perineal pad saturation within 30 to 60 minutes in a postpartum client, which may be suffering from bleeding. If there is 1 to 2 inch stain, it's considered scant or blood loss of 10 ml, 4 inches, light to small, or 10 to 20 ml, 4 to 6 inches, moderate, 25 to 50 ml. And if the perineal pad is saturated within an hour, it indicates heavy bleeding. So ultrasound is the diagnostic test of choice for bleeding disorders of pregnancy. So let's try answering a sample question. A 30-week pregnant client was in a car accident. Initial assessment reveals bleeding. The nurse should prepare the client for, this is what I'm trying to tell you guys. What's the diagnostic test for bleeding in the 3rd trimester? So that's ultrasound. Okay, now, what are these tests? Okay, non-stress test is a test for fetal well-being. You have to induce fetal movement and then monitor acceleration of the heart rate. Okay, if there's an acceleration above 15 beats per minute in 2 periods within a 5-minute time frame, then the test is positive. It means the baby is responsive. Contraction stress test is a test for fetal heart rate deceleration. So it correlates uterine contraction with the fetal heart rate. So this is trying to test if the baby can withstand uterine contraction during a labor process. In this case, if the patient's heart rate drops, deceleration means slowing of the heart rate when uterine contraction occurs, then it could mean that the baby may not be well enough, okay, to withstand the stress of the labor process. Now, take note also that there are 3 different types of deceleration. Okay, you have your early, late, and variable deceleration. Early deceleration is expected because it's due to head compression. Late deceleration is due to placental insufficiency, and it could be indicative of fetal distress, so it's a priority. Variable deceleration could be due to cord compression. So pay particular attention to that concept. Now, biophysical profile is also a test of fetal well-being. There are 5 specific criteria. You have fetal breathing, fetal movement, fetal heart rate, reaction to non-stress test, and amniotic fluid volume. Okay, based on the 5 criteria, okay, the baby is graded. Okay, you don't have to remember about biophysical profile, just these 2. Okay, excellent. Let's move on. So once again, when the non-stress test is considered positive, you have increased heart rate. For contraction stress test, it's considered positive when the heart rate decreases or decelerates. A positive non-stress test indicates that the baby is okay, healthy, responsive. A positive contraction stress test indicates that the baby is not okay. The baby may not be able to withstand the stresses of the labor and uterine contraction process. Okay? Okay. So which one should be your priority? Well, the baby with a positive contraction stress test. You need to immediately refer the mother. Okay? Okay. Now, this is another issue that most of those who study for the test may sometimes, you know, forget to browse their notes on. Why? Because once again, it's very basic. Okay. But a lot of them end up answering questions incorrectly. Now, let me tell you one thing. Seat belts are very important. No matter how far or how short the distance you're driving to is. So it simply means that whether a pregnant woman is going to drive for 3 minutes, 5 minutes, 10 minutes, 15 minutes, 30, it's immaterial. The moment that they get inside that car and attempts to drive, you have to tell them to wear their seat belts right away. But they have to wear it properly. So pregnant clients should wear lap belts under their abdomen and across the upper thighs with the shoulder strap fitting snugly between the breasts. So this is not the way to do it. This is supposed to be lap belt. So this is the way to do it. And the shoulder strap should be between the breasts. Okay, so lap belt and shoulder strap. Okay? So this is how you do it. Lap belt and shoulder strap. Okay. Pregnant clients must use seat belts across the trunk and lap belts below the abdomen. Okay. So let's try answering a sample question. The pregnant woman, 36 weeks of gestation, states that she doesn't want to use seatbelt anymore. What did I tell you just a while back? Okay. You always remind the pregnant patient to wear the seatbelt no matter what. So what should the nurse advise? Okay. Our advice should be, okay, to instruct the mother, you need to use your seatbelt and lap belt under your abdomen. You don't say you loosen the fitting, no. You don't say you need to tighten your seatbelt, no. You don't say you don't have to use your seatbelt anymore since it causes you discomfort. No, the most important thing is instruct the patient to use the seatbelt and the lap belt, okay, under the abdomen. Okay, now, this is also one confusing concept that I'd like to clarify. So we're talking about decorticate and decerebrate position. Now, what if you are given an illustration and then you're being asked to type what type of abnormal positioning is the patient manifesting? Is it decorticate or decerebrate? That's kind of easy. It's easier than when what you are being given is actually a description of the arms flexed, abducted towards the body, with the wrist internally rotated and the legs in full extension. So that's more difficult to decipher. It's easier if you know how to label the position based from an illustration or a picture, okay? Okay, so here's a concept. Decorticate rigidity is characterized by unilateral or bilateral postural change, meaning one-sided or both left and right sides, of upper extremities flexed and adducted, the lower extremities in rigid extension. So it's due to lesions in the thalamus, internal capsule, or cerebral white matter. This is how it looks like. That's decorticate posturing. What do you need to pay particular attention to? Look, the arms are adducted, meaning it's towards the body, and the elbows are flexed, and the wrists are flexed, okay? The legs are in full extension, okay? So that's decorticate rigidity. Maybe sometimes it's easier for you to remember decorticate rigidity like this. This is decorticate. This is what you do during the first night of honeymoon when you pull the blanket over yourself and do like this. That's the corticate rigidity. But when somebody pulls it down, then it becomes decerebrate rigidity. During honeymoon, okay? So let's move on. Now, sometimes what's difficult is that they're asking you to label this and then you misspell decorticate. What an opportunity lost, okay? So you begin to question yourself, did I spell it correctly? So pay particular attention to the spelling. It's decorticate, okay? Decorticate rigidity. Now, decerebrate rigidity is characterized by posture found in those with lesions of the upper part of the brainstem and the cerebrum. The patient lies in rigid extension, the arms internally rotated at the shoulders, elbows and knees, hips extended, fingers, ankles and toes flexed. The jaw may be clenched with the neck hyperextended. It looks like this. Look, jaw will be clenched, the neck hyperextended, and the legs are also extended. Look, even the arms are extended. Okay, so therefore, decorticate rigidity, decorticate, the one we had a while back, is abnormal flexion. Decerebrate rigidity, this time, what we have here, decerebrate rigidity is abnormal extension. Look, arm, okay, the neck are extended, and the legs are also extended. Okay, now to simplify, let's compare. Decorticate, remember this is a code. Decorti, T, means there's a lesion or a problem in the thalamus, T, decorticate. Decerebrate, B, there's a problem in the brainstem or cerebrum, B, okay, decerebrate. So decorticate thalamus, decerebrate brainstem or cerebrum, okay? Next, in terms of the arms, in decorticate, bent towards the body with the wrist and fingers held onto the chest, bent towards the body, adducted. In terms of decerebrate, the arms and the neck are extended. See, the neck with the jaw clenched. Okay, here arms are adducted, here arms are extended. Okay, legs in both positions are in extension. Okay, as a whole, decorticate rigidity is described as abnormal, sorry for that wrong spelling, abnormal flexion, and decerebrate rigidity, it's abnormal extension, okay? So decorticate, abnormal flexion, decerebrate, abnormal extension. Decorticate, problem in the thalamus, decerebrate, problem in the brainstem and cerebrum, okay? Okay, great. So, test-taking key, stay focused and don't be confused. Okay, don't focus on trivial things. There are things that are nice to know and there are things that are just good to know, but these are not must knows. So if there are things that's only you who knows about it, chances are nobody would ask about it on the test because nobody knows about it other than you, okay? So remember, it doesn't make sense knowing something that you think you're the only one who knows it. It's not gonna be there. Okay? Kung ikaw lang nakakaalam, wala yan sa test. Okay? So I remember a schoolboy excitedly tells his mother, Mom, I was the only one in the class who answered the question. The mother happily asked her son, what was the question? The son answered, who didn't finish today's assignment? Okay? Don't be like this little boy, okay, who's the only one who got the answer to the question, but the question is actually something that's not positive, okay? It's very negative, okay? So here's actually an inspirational message from Reynold. Okay, Dr. Ray Gapos, I had difficulty when I did my test. It's super hard. I stopped at 75. Took me 4 hours and 25 minutes. My last question was about osteoporosis. Fill in the blank. Most of the questions was the SATA type, which was very confusing. Thank God there's Gapos review. Just a tip for the nurses taking the NCLEX, always remember the strategies on how to select the best answer. That's your weapon. Well, he posted this publicly on my social media account. The good thing about Gapos review is their style of teaching. It is very methodical. They have a way of for nurses to remember the concept. This always a repetition. It's like a mastery of the whole 4-year BSN program into a 20-day review class. And it's good and there's no dull moment and it's actually a fun-filled class. Dr. Gapos, I remember The contents of your ABCs of passing foreign nursing exams. That book is phenomenal. I kept my copy and I'm a proud Gapos babe here. Thank you very much. And somebody named MJ replied, we'll keep this in mind. So those of you, you are all receiving a PDF copy of my book. And then those who actually are included in the top 10, we're going to send you personal emails and you will receive physical copies of a learning package from me, okay? Now, another basic concept, injection sites. Imagine you're seated in front of your computer and all of a sudden there's an illustration and it's asking you this question. What is the maximum amount of medication you can inject in this site? And you begin to ask yourself, oh my God, what is this? Okay, so I'd like to highlight one thing, class, okay? There are 3 injection sites that I'd like to focus on. First would be vastus lateralis, second would be deltoid, and third would be gluteal. Okay, let's talk about vastus lateralis. Vastus lateralis is actually the injection on the lateral side of the upper leg. Okay, this is used for children below 36 months, and at birth it's actually used for vitamin K injection. Okay, question. What is the maximum amount of medication that could be injected in vastus lateralis? It's 2 ml, okay? 2 ml, it's for adults, okay? However, if you talk about deltoid, here, the deltoid, okay? What's the landmark? The acromion process, you will have to measure 6 centimeters or 3 fingers breadth below the acromion process. That's where you could actually inject. Okay, but how much is the maximum amount of injectable medication that you can inject in your deltoid muscle? For adults, it's 2 ml. For children, take note, for children, it's actually 1 ml. So remember our guide again. If the child is below 36 months, the best site, vastus lateralis, is if above 36 months, the best site, deltoid. However, the maximum is only 1 ml. For pediatric patients and 2 ml for adults. So if you're administering medication that's more than 1 ml, where is the best site? The third one, the gluteal muscles, okay? Where you can administer as much as 5 ml of medication. However, I'd like to highlight one thing, and remember this, you have to inject at the upper outer quadrant of the gluteal muscle to prevent hitting the sciatic nerve. Okay, so if you hit the sciatic nerve, possible complications could occur. Okay, so if in the actual example you are given these options, okay, you have to know where to mark an X for the best site. Here, it has to be like 6 centimeters below the acromion process and maximum of 1 ml. Okay, this is ventrogluteal. Okay, ventrogluteal. Okay. Thank you for listening. And then you ask me this. Why is it that of all the cranial nerves, it's cranial nerve 5 and 7 that you're emphasizing? My answer is this. Because most of the, among all the cranial nerves, most of the functions of cranial nerves 5 and 7 could be easily interchanged if you have not mastered assessing these cranial nerves, okay? So before anything else, okay, let me integrate, okay. Trigeminal nerve is actually your cranial nerve 5. Facial nerve is actually your cranial nerve 7, okay. Both are sensory motor nerves. So what does that mean? Okay. The sensory root of the trigeminal nerve is responsible for facial sensation. The motor root is responsible for chewing. So you assess the sensory root by using a pin or a cotton ball to assess the corneal reflex, okay? And you assess the motor root of the trigeminal nerve, cranial nerve 5, by asking the patient to clench the teeth. Don't forget this, clench the teeth. So chewing and clenching the teeth, cranial nerve 5. Now, facial nerve is also both sensory and motor. The sensory root of facial nerve is responsible for the sense of taste for the anterior tongue, okay? And to assess this, use swabs dip in various solutions and ask the patient what taste is it related to. And then for motor nerves, for the motor root of facial nerve, cranial nerve 7, ask the patient to move the face, okay, smirk or blink, okay, and then ask the client to reveal the teeth. Okay, now here are the differences. Look, if you're talking about facial sensation, cranial nerve 5. If you're talking about facial movement, then that's cranial nerve 7. If you ask the patient to clench the teeth, cranial nerve 5. If you ask the patient to reveal the teeth, that's smiling, cranial nerve 7. Once again, facial sensation, cranial nerve 5. Facial movement, cranial nerve 7. Ask the client to clench the teeth, cranial nerve 5. Ask the client to reveal the teeth, then that's cranial nerve 7. See? Now, that's the reason why it's being asked. Or sometimes we are so confused because some of their functions overlap. Okay? Okay. So, if you are going to be asked on the test, which cranial nerve is responsible for the corneal reflex? The sensory, take note, reaction, let me be clear, the sensory reaction to the corneal reflex is a function of cranial nerve 5. However, if you will be asked about the motor response to corneal reflex, let me be clear, then that's cranial nerve 7. Once again, the sensory reaction to the cornea of the corneal reflex is due to the function of cranial nerve 5. But the motor response to corneal reflex is the function of cranial nerve 7. So if you talk about corneal reflex, it's both a function of cranial nerve 5 and cranial nerve 7. But if it's being asked, it's only the sensory stimulation of the corneal reflex, then it's cranial nerve 5. If it's going to be the motor response to corneal reflex, which would lead to blinking, okay, that's cranial nerve 7, facial nerve. Okay, now, what if the test will ask you about a patient who comes to the clinic exhibiting hoarseness, hoarse voice, okay? This is due to an abnormality of which cranial nerve, okay? This is due to the abnormality of your vagus nerve. That's cranial nerve 10, okay? Because one of the branches of your vagus nerve, okay, gets continuous with the laryngeal nerve. Therefore, if the patient is having problems such as dysphagia, hoarseness, dyspnea, then that's associated with cranial nerve 10 or the vagus nerve. Now, what if, let's have the what if mentality again. What if it's not vagus nerve that is asked? What if there's a patient who is gagging, having difficulty swallowing, okay? Which cranial nerve is affected? Then that's your glossopharyngeal nerve, cranial nerve 9. So once again, what are the things that we need to remember related to cranial nerves? Which cranial nerve is responsible for the sensory response for corneal reflex? Cranial nerve 5. For the motor response for corneal reflex? Cranial nerve 7. Cranial nerves that's affected when there's hoarseness? That's vagus nerve. Cranial nerve that's affected when there's gagging and difficulty swallowing? Then that's cranial nerve 9, your glossopharyngeal nerve. Okay, now let's move on to the drug cyclosporine. I remember there was actually one student who asked me about cyclosporine, and she asked me about, sir, why is grapefruit juice contraindicated in a patient who is taking cyclosporine? Will it decrease the absorption of the drug? Not necessarily, but your grapefruit juice, in Tagalog we call it suha, okay? Hindi yun grapes ha, suha. Okay, your grapefruit juice would actually increase the side effects of your cyclosporine. So what is cyclosporine? It's actually an immunosuppressant. It's given to prevent organ rejection, especially if the patient had transplant of the liver, the kidney, or the heart. Okay, so it's given orally using a syringe. You never use, okay, your household spoon to measure the amount of cyclosporine because it could be inaccurate. So take note that the dose of cyclosporine will be dependent on the weight of the patient, okay? So if we tell the patient to avoid grapefruit juice, can we mix cyclosporine with other types of juice? Yes, it could actually be mixed with orange juice, okay? It could also be mixed with milk or chocolate drink to disguise the bitter taste, Okay, common side effects of cyclosporine would be gastrointestinal, nausea, vomiting, diarrhea, headache, dizziness, and it could potentially cause gum swelling. Okay. So here's a sample question. A client's taking cyclosporine following a kidney transplant. A nurse is reviewing the client's serum laboratory results, which finding indicates that the client may be experiencing acute rejection. Place an X on the laboratory value result that suggests acute rejection of the transplanted kidney. Now, even if you don't have a working knowledge of cyclosporine, just focus on kidney. The most sensitive index of kidney function is your creatinine. The normal creatinine is 0.5 to 1.5 milligrams per deciliter. So an elevated creatinine indicates rejection of the transplanted kidney. That's a way to do it. So put an X on creatinine. Yay! That's being smart, you know? Okay. Now, let's move on to radiation therapy. So if you talk about radiation therapy, remember this functional concept. In sealed source of radiation, urine and feces are not radioactive. But it's very important to tell the patient to flush the toilet, not once, but twice, okay? To minimize radiation exposure. Here we go. Here's a sample question. Which of the following interventions is appropriate in providing care for clients with internal radiation? Okay, we put the patient in a private room and make sure that the bed of the patient is in the middle because radiation could actually pass through the walls, okay? Then rotate the staff caring for the patient. Yes, because they could actually absorb the radiation. Encourage the client to perform own self-care to minimize exposure of others. Provide shield in the room. Yes, if the radiation source is dislodged, you cover it with a lead apron, so that it minimizes lead exposure. Maintain limited exposure time of visitors, yes, to 30 minutes. Do not assign a pregnant nurse to the patient, yes. Put a sign on the door that reads, caution, radioactive material, yes. Okay. Now, brachytherapy involves internal radiation like use of session. And a client undergoing brachytherapy, take note, should not be delegated. So, when we talk of brachytherapy, it involves implant that is placed very close to or inside the tumor. Sometimes these implants are left there to stay forever because only the amount of radiation that's needed by the patient is actually included in the implant, such that it could be left in place, okay? It is placed so that it harms as few of the normal cells as possible. The radioactive material may be left in the body for only a short time, or it may be left there permanently. It allows the doctor to give a higher dose of radiation to a smaller area than is possible with external radiation treatment. So the difference is, for internal radiation treatment, it's more targeted, so less area will be exposed to radiation, okay? So, you have intracavitary radiation, which simply means it's placed inside the body cavity. Interstitial, which simply means the implants are placed near the cancer cells. Both methods involve the use of pellets, seeds, ribbons, wires, needles, capsules, balloons, or tubes. Okay? The next, NCLEX QUICKFIX test-taking key, ask for God's guidance. It's the last test-taking key, but it is the most important of all. Okay? Is the most important of all. Remember, your hardest times often lead to the greatest moments of your life. Keep the faith. It will all be worth it in the end. And I promise you, we'll get through this. See you once again. You'll need to register anew if you want to join me on October 3. If you have yet to pass your NCLEX. I know those who are taking the test within September and have attended my session today, NCLEX QUICKFIX, you please do watch my YouTube videos on Gapos Mentors. We have more than 100 videos there. Please focus on those which we have uploaded because, okay, all of those are very, very representative of the things which you need to master for the test. This is your colleagues, actually, Mentor Ray. Call me Ray, okay? Please feel free to send me a note a note of encouragement, discouragement, okay, a note of criticism, anything that will help us improve, we will treasure it. So that next time we will know how to adjust for all of your idiosyncrasies. So we're gonna see each other again October 3, but in the meantime, I'd like to see you all watch my videos, especially the new ones we are uploading. We'll try to edit this thing and try to figure things out when we'll upload it. But for those who are taking the test immediately next week, watch the videos we've had, and I promise you, and I thank you for attending today's session, because I know for a fact this is going to start, jumpstart your interest in terms of bettering yourself as a test taker. So once again, this is Ray Gapos saying, use your concepts in a functional way, the Gapos way. Thank you very much, colleagues, and see you once again.